My name is Yuri Molina, and I'm from Aix-en-Provence, France, but currently based in Evanston, Illinois, and our company is SwipeSense.
My name is Mert Izeri. I'm from Istanbul, Turkey, but also I currently live in Evanston, Illinois.
The SwipeSense is a portable dispenser. It's like this. It clips onto your scrubs of a physician or nurse, and basically you use a button on the back, you squeeze it, gets a dose of hand sanitizer in your hands, so the staff no longer need to run back and forth for a wall-mounted dispenser. At the same time, electronics inside capture data that we can use to give individual feedback to healthcare workers.
Our mission at SwipeSense is simple. Save the 100,000 lives that are lost every year due to hospital-acquired infections in the US alone.
When Mert and I were in college, we lived across in the dorms from each other, and we were working on a summer project. It was part of a student group at the time called Design for America that we helped start. And basically the idea was to bring students from different backgrounds and set them loose on local social challenges. And for us, we partnered with a local hospital. This was the North Shore University Health Systems. And we partnered with their infection control department on a serious challenge that they were facing. And this is something called hospital-acquired infections. It kills about 100,000 people every single year in the United States alone. That's 100,000 deaths, more deaths than AIDS, breast cancer, and car accidents combined.
We set out to fix that problem. We went in there, started observing people, really understanding what was wrong with hand hygiene itself. And what we believe is it's never the user's fault. It's never the person who's actually doing the job. It's almost always the environment, the product, the system that's the problem.
So the solution we came up to the problem of hospital-acquired infections is what we call SwipeSense. And essentially it addresses the two problems. The first is a lack of convenience, that healthcare workers need to wash their hands inside of the patient's bedroom. And the second is a lack of access to data. Hospital staff aren't aware that they're not doing a good job. Most people think they're doing well.
Up to 70% of these infections can be prevented with proper hand hygiene. When me and Yuri graduated from Northwestern University in 2011, we decided that we had to push our idea forward. We started working with the Siegel Design Institute at Northwestern University, collaborated with Northwestern Memorial Hospital, and decided to pilot our idea. And while this was happening with Northwestern Memorial, we got accepted into a business incubator called HealthBox. HealthBox was really what kicked our business into gear and made us realize that we were running a real startup here. So we got through the 3-month process with HealthBox. Right afterwards, we started our fundraising process and managed to raise $1.17 million. While all of this was happening, we hired our good friend Jory Hartman as our CTO to join the company. And this is where the company is at right now. We are signing up hospitals by the day. Currently, we have 2 hospitals that are using the SwipeSense system, but last week we were at a trade show where we signed up 50 more.
Which means we're going to be saving our very first lives this summer.